Hello. In previous videos, I've explained the ultrasound diagnosis of esophageal diverticulum on several occasions. However, I've received feedback that it is still not easy to diagnose for beginners. Therefore, I've structured this new video to be more specific and easier to understand. An important point to emphasize is that misdiagnosing an esophageal diverticulum as a thyroid nodule and performing a fine needle aspiration or biopsy can lead to serious complications. Therefore, accurate diagnosis of this condition is crucial. Let's take a look at our first case. A small hypoechoic nodule is seen in the posterior aspect between the upper and middle thirds of the thyroid. In the initial image, calcification is suspected. However, in a transverse image taken to better visualize the lesion, a ring-down artifact is observed, suggesting the presence of air inside the lesion. In both transverse and longitudinal video clips, the lesion is shown to be connected to the esophagus. This lesion is an esophageal diverticulum. Moving on to the second case. This patient has secondary hyperparathyroidism and underwent an ultrasound for localization of parathyroid lesions. On transverse ultrasound images, 3 extrathyroidal lesions are seen on the left side, and 1 on the right. Here are the longitudinal images. Let's look at the transverse video of the top 2 lesions on the left. The second lesion is shown to be connected to the esophagus, and thus can be diagnosed as an esophageal diverticulum. In the longitudinal video of the same lesion, the connection to the esophagus is also visible. Although these lesions may initially appear to be parathyroid pathology, careful observation with the possibility of esophageal diverticulum in mind allows for accurate differentiation. Now for the third case. This is a postoperative follow-up ultrasound in a patient who underwent left thyroid lobectomy. A resident noted a small lesion in the surgical area and suggested a differential diagnosis of suture granuloma versus esophageal diverticulum. Upon reviewing the ultrasound, I advised further imaging consistent with a diagnosis of esophageal diverticulum. Here are the images taken by the resident after becoming more confident in the diagnosis. What differences can be seen between the initial and follow-up ultrasound images? In the confident images, the area that initially appeared to be calcification is revealed as air due to the presence of a ring-down artifact, and the lesion is closely attached to the esophagus. In the earlier images, the lesion appears separate from the esophagus, and the artifact resembles rim calcification rather than a typical esophageal diverticulum. Ultimately, ultrasound diagnosis accuracy varies significantly based on the examiner's experience and understanding of the disease. Let's move on to the fourth case. This case highlights the ring-down artifact seen in esophageal diverticulum. It is distinct from the strong posterior shadowing seen with calcifications. Air is also clearly visible on CT imaging. In this short video, we show both the connection to the esophagus and the ring-down artifact. Here's a tip for identifying esophageal diverticula on ultrasound. They usually occur above or below the cricopharyngeus muscle, which is part of the inferior constrictor muscle group, located posterior to the cricoid cartilage. This muscle lies around the inferior horn of the thyroid cartilage. Therefore, if a lesion is seen in the posterior aspect between the upper and middle thirds of the thyroid, esophageal diverticulum should always be considered. Next, let's look at the fifth case. This is a patient with primary hyperparathyroidism. The lesion is located posterior to the upper to mid portion of the thyroid, so a differential diagnosis including esophageal diverticulum must be considered. However, since there is no connection with the esophagus on ultrasound, this lesion is diagnosed as a parathyroid lesion. And here's our sixth case. This patient was referred for evaluation of a suspected thyroid cancer. Given the lesion's location, connection to the esophagus must be carefully checked on ultrasound. Ultimately, no esophageal connection is observed, and the lesion is confirmed to be a thyroid lesion. Alright, let's wrap up with our final case. This patient, who had undergone thyroidectomy, was referred from another hospital for suspected recurrent thyroid cancer. The previous hospital's FNA showed no cancer cells, so the patient was referred for further evaluation. On ultrasound, the lesion is located below the inferior horn of the thyroid cartilage. Although there is an echogenic spot within the lesion, the posterior shadowing is weak, and a definitive ring-down artifact is not seen. This suggests that the examiner did not consider the possibility of esophageal diverticulum and thus did not capture the characteristic findings on ultrasound. Additionally, if squamous cells are found on cytology, esophageal diverticulum should be reconsidered, as squamous cells are rare in thyroid cytology. In conclusion, ultrasound diagnosis heavily depends on the examiner's attention to detail and prior knowledge of the disease. Esophageal diverticula are frequently misdiagnosed as thyroid nodules or parathyroid lesions. When misdiagnosed, unnecessary FNA or biopsy may cause serious harm to the patient. Therefore, always assess for connection to the esophagus, and consider the location, shape, artifacts, and all imaging features comprehensively. Continuous learning and accumulation of experience are essential. There are many excellent learning resources available online, so we encourage beginners to make full use of them. Thank you.